the tend to a sore rotator cuff is literally the best thing in the world. We can't prove that, but it's a very good thing. In prone, arm hanging off the edge, and what we're essentially doing is kind of pulling and moving things through rotation and or traction through the arm. So rotation is great for getting to infraspinatus and teres on the back of the shoulder blade. So I'm going to palpate for the spine of the scapula, find the medial corner, find the inferior angle, and then I know it's this piece of tissue here that I'm really after. And if we just start with some active movement, so you're just going to actively come up into there and then back into internal rotation. More restricted one way than the other? Internal rotation. So we're stretching out infraspinatus and teres when we do that. So that's a good place to start hunting. So we can have a quick look with hand first, or we can just scan with 10, but we're really after bits that feel lumpy, but more importantly are tender to the person on the inside. So we are scanning through the tissue, looking for anything that is tender, kind of combo assessment of just good old poking and prodding with a thumb, and then just running the tend through it will often help you to identify the sorest bit within that area. Nowhere too bad through there?
Just
up a bit, down a bit, yeah. And this is what we often need, is just talking in to the bit that feels like it's the sorest. We want to be right on the sorest bit, but nice and gentle. So we get there, make it a bit sore, and then back off a smidge. And then with that pressure there, what we can do is essentially guide the arm through the rotation that it's finding more difficult, all the while keeping the tend in and around that sore area. Not really pressing it in, just having it be there. More pressure does not equal more effects. Then I'll usually do 5 or 6 passes, and then maybe have another scan through the region and see if I can find another sore bit that's worth working on. Usually we'll see some reduction in tenderness within a minute or two of work, so we don't want to get stuck on any one bit of tissue for too long. In most cases, a little bit of treatment to the sore region and several sore spots will yield better results than treating one spot for ages and ages. So a couple of minutes, any one spot, and then moving on. So that's infraspinatus and teres we can get to really nicely like that. If we go to the other side of the spine of the scapula, we're going sort of through traps and thinking about supraspinatus being down there in the suprascapular fossa. And the focus tend head into here is brilliant. That slightly more teardrop shape really allows me to kind of get a bit of depth through that relaxed short upper trap. Find some feedback from supraspinatus, generally kind of angling the tend down along the line to the tip of the shoulder, and then using a bit of light traction and arm ab and adduction to get some motion in the tissue underneath. And supraspinatus does really well because it's quite small to these held techniques. So basically just find the sore spot, pin that piece of tissue gently with the tend, and then move the arm under. A little bit of traction, and then coming through ab and adduction type movements, and even a few circles through the elbow there. So there's some nice ways to get tend helping your patients with shoulder problems, in particular rotator cuff. One of the particular strengths of the tend massage tools is their ability to treat around bony, gristly areas. So the kneecap and the front of the knee is a great example, where we might use conventional massage guns up through quads and down through calves and even kind of tib-ant region. But really around the kneecap, there's not much that we can do there. So a good old wiggle of the kneecap and the fibula head is often great bits of manual therapy to do. But a lot of what that's doing really is stimulating the retinaculum and just the gristle of all the the soft tissue attachments of the patella and the surrounding structures. So TEN's an excellent device. And another point worth making here is TEN goes great through thin layers of clothing. We don't need to go right to tool-on skin contact. You can feel it just about the same through thin layers, right? So basically just starting from the kneecap and working out like a star and just looking through the tissue, inquiring where there's any kind of tenderness and soreness through there. Not too bad.
No, it's good. A little bit right up by the patella, like all there.
So you will always get these bits where something around that lateral aspect of the patella is nice and tender. So if they can't relax, go lower. Go lower again. Back to the beginning. So level 1. So we want to keep it non-threatening, and it is always useful to see and feel stuff like this, right? Where you think that's incredibly gentle, and it is.
Yeah.
But when it's right on the right spot, it's as much feedback as you can take without it turning into something horrible and threatening. So getting to those really, really tender, very focal spots, often away from the soft tissue. You won't have as many kind of tools in the treatment box, as it were, to treat them. And the pain relieving effects that we get from focal vibration are absolutely perfect for getting in and just improving that kind of baseline function around the kneecap before we get on with loading it up, stretching the quad, mobilizing the foot, all those important things we need to do. But none of it's much good if the kneecap remains as sore as hell. So tend around the edge is great. And then one of the massive advantages of using tend within your clinic is if the patient is minded to sit up, have a go. They just do it themselves. Saves you so much time and effort. But it's a great piece of homework as well, and TENs owned by patients are really popular. Lots of people have a massage gun, but adding a TEN to that kind of home library of treatment tools is really, really useful and very popular within our clinic. It's nice, right? Like you can feel a bit more. It's better when you do. Cheers very much. The feedback loop is different, right? Like you don't get as many surprises. So particularly if people are nervous, actually saying, well, this bit you can do yourself is really empowering to them, increases their sense of safety. And for some people, they'll be much braver and challenge those sore bits more. For other people, that sort of self-protective loop means they'd much rather have someone else do it. But it is a really valid point that quite often treating yourself, even if you have no anatomical knowledge, will be more effective because you're on the inside of that feedback loop that the sensory device is causing. Who knew?